Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. This is our 34th episode. In this episode, we are going to talk about personality disorders. It's a group of disorders. It's an important group of disorders as we are seeing more and more people coming to us with personality disorders. So, to understand what is personality disorder, we need to understand what is personality. Personality is a word we use in our day-to-day conversations. But when we talk about personality in a mental health concept, we are talking about the holistic personality. We are talking about beyond the looks, beyond the way he dresses or way she dresses. We are talking about psychological makeup, which includes the thinking, the behavior, the perception, everything, emotions, everything together is a personality. If you want to put it in a simple term, personality is made up of characteristic patterns of thought or thinking, feelings, the emotions, and behavior, and also perception. That makes a person very unique. So each personality is unique to that particular person. People can have different sets of thoughts, different sets of emotional reaction, different sets of perception. And depending on perception, thinking and emotion, they can behave differently. So each person's perception, thought and behavior and emotions differ. Because no two persons can have a similar, 100% similar experiences in life. These patterns of thinking, these patterns of behavior, these patterns of emotional reaction and the perception are called as personality traits. Each of us have our own personality traits. It develops over a period of time. It's not that it develops in a month or two. It develops over a period of time. Our personality develops as we grow, from our childhood to adolescent to adult to beyond that. A child is born as a clean slate. There is nothing in the mind of the child. Child doesn't have any thinking at that point in time as the child is born. Probably it has perception that is also very limited. It develops over a period of time, in weeks and months. The depth of vision, hearing, everything develops gradually. As the child develops these faculties, the vision, the hearing, it also develops perception, the pain perception, the visual perception, the auditory perceptions. And as it develops the perceptions, it picks up the information from the world. How the mother talks, what is the tone of the mother, how the father talks. All those things goes into the child's mind and gets stored somewhere in the brain. And millions bits of information are stored in our brain because of our perceptions. And those data, the stored data, forms the basis of thinking. So if I'm going to think about what shall I have for this lunch, today's lunch, then I go into my data which has everything about food. Vegetarian, non-vegetarian, or which cuisine I want to take, everything is there. So all I need to do is go on and retrieve those information and analyze and decide. And that perception and that data also loaded with emotions. If you had a particular dish that was terrible, then that has certain emotions. Probably disgust, or probably hate for that kind of a food. Or a particular food which is very tasty, I loved it, I had so much, then the happiness is clubbed with that perception. So a child grows with these data, these emotional reactions, all those things. And perception, thought, emotion together produces behavior. As I said, child is born with a clean slate. And then the environment, the people around the child, every stage in their development puts in lots of data. And this data makes the person think in a particular way, emote in a particular way, behave in a particular way. That's why each personality is unique. This behavior, this thinking, this perception forms a personality. No two personality can be same, because no two persons can have exactly same experience, even if they are twin. Individually, they might have different experiences. When I say experience, I'm talking about if I see a person about 30 years old gentleman or a 30-year-old lady, I'm looking at 30 years of experience, 30 years of data gathering, 30 years of emotional reactions. And that is completely unique to that particular person. I would say personality is like your signature. No two signatures can be same. No two personality can be same. Our emotions, thinking pattern, to certain extent, not largely, to certain extent, can be inherited. He is as angry as his father, or he is as reactive as his mother. So this is how we see people. That is a bit of an inheritance what they have. So our personality, there are research to support this inheritance concept. So some part of our personality can be inherited. And then comes the nurture. So inheritance is nature. By nature, we have certain qualities in our personality. Then comes the environment. When we talk about environment, talking about child development. As a child, how I developed, how was my family, how was my sibling, my reaction to sibling, my relationship with my parents. And then I go to the school, my classmates, schoolmates, teacher, everything counts, everything shapes us. It is like we are born with a slab of marble, and many factors slowly shape us into a sculpture. Now we chisel away unwanted things, and we give a shape to our personality. So our personality gets shaped over a period of time, very gradually, and it is there to stay for longer. Personality don't change over a period of time. There might be ways we can change certain things, by and large, they are ingrained, they are enduring way of thinking and behavior. So what we inherit, how is our childhood, adolescent, adulthood, what we learned, what we experienced, and the environmental influences, what is happening around me, both the human factors and environmental, physical factors also. What kind of a house I'm living in, what kind of a society I'm living in, what kind of a culture I'm living in, everything shapes our personality. That is how we develop our personality. Okay, you said each personality is unique, and that means, is there any types of personality? Yeah, even though I said each personality is unique, it is like their signature, we can kind of broadly try to divide them or typify them, give them the types. Number of research has gone into, mainly from psychologists and also sociologists, and of course psychiatrists also. But major contribution comes from psychologists. Number of theories. I'm not going to give you all those theories, hundreds of theories are there. So let me pick up few things and then I'll explain very briefly, because we need to talk about disorders. One theory says personality is grouped into introvert, extrovert, ambivert. You might have heard this term. Extrovert, introvert, use it in our common conversations. Introvert is the type of person, they are, as the name suggests, they are keeping to themselves. They are a bit reserved. They are not very sociable person. They feel very uncomfortable in a social situation. That is introvert. Extrovert is opposite to that. They are very outgoing, very talkative, very socializing person. That is one type of person. In between these two, a compromise of introvert and extrovert, there is another group of person, we call it as ambivert. There are a number of research to support this kind of a theory. Then another theory comes from this concept is neuroticism and stability. Neuroticism, more anxious person, very edgy. Stability is more, they are more stable. Now they don't have that overriding anxiety features. Psychoticism and socialization, another parameter, dimension. All these personality types are in dimension. It is not like concrete. It goes in a dimension. Introvert to extrovert, in between ambivert. Then there is also a type called type A, type B, and then later on they also talked about type C and so on. Type A persons are very energetic, go-get kind of a person, achievers, and they are always restless. They might have time management problem, and they are also more likely to get cardiac problem. They are more likely to get heart attacks. Type B person is more sedate, calm, and they measure talk and then behavior. So this is another typifying or another grouping of personality disorder. And there is also 16 factor personality, where they group the person into 16 different types of personality. Very recently, about 2023, a new type of personality disorder is being talked about now. This comes from US. So let me talk about it because it's a new concept. Introvert is a group of personality, a group of person exhibiting the following characteristics. They are the outsiders in any group, in any social construct, because they don't gel well with the social groups. They are not very sociable. They are a bit detached. They might be seen in a social group, but still they are detached in that. And they have a very selective connection. They don't kind of connect with everybody. They don't relate with everyone. They might have a number of people they are quite comfortable talking to them, but in that they'll have a very selective friendships. So they are very selective in their connection with their relatives or in their friends group or in the work group. And they are more comfortable in solitude. They like to be alone. They are not very comfortable in a social group. Given a choice, they would like to be alone. So they are more comfortable in solitude. They don't get perturbed spending long period of time in solitude. And they are also good thinkers. They constantly think. It can also be overthinking that can lead to problem. So they are thinkers. They constantly, something runs in their mind all the time. And they are not very comfortable with the traditional concept, traditional behavior or traditions, and also rituals. They may not like rituals. They don't kind of confine themselves into tradition rituals. This is a new concept which needs to be tested further. Next, let's go on to the personality disorders. Personality disorders are patterns of thought, feelings, emotions, and behavior that deviate from cultural expectations and are pervasive and inflexible and lead to distress or impairment in functioning. So each word is important here. Enduring patterns. It is not that it is here today and then disappears a couple of weeks later. No, it is enduring patterns of thought, feeling, and behavior. We can also include perception also. So perception, thought, feelings, and behavior. And it is enduring pattern. And it deviates from the norm. It deviates from the cultural expectations of that group, about that society. And it is pervasive. It affects all the aspects of the person's life. So the way he behaves, the way he reacts, the way he relates, everything is affected. So it is pervasive. And is inflexible. You can't change it. That's how they are made. That's how they are developed into. So it's inflexible. So we have discussed about enduring pattern of thinking, emotions, and behavior. And it doesn't gel with the society in which they live. And it is pervasive and is inflexible. You can't change it. Another important parameter in this is it leads to distress. Their personality leads to behavior, leads to feeling that is quite distressing for the person. Patient suffers. The person with personality disorder suffer. Sometimes suffering doesn't stop with them. Others relating to them, others near the family members, work colleague can also suffer due to that behavior. And it can lead to impairment of functioning. It can lead to dysfunction. So each concept is very important to understand the personality disorder. So to sum it up, it is an enduring pattern of thinking, feeling and behavior. It deviates from cultural norm or the society in which the person is living. It is pervasive and it is inflexible. Now it's very rigid pattern and leads to distress and dysfunction. Distress in the person who's having a disorder, it can also lead to distress in people around him, close relatives or family, work, friends, and it can lead to dysfunction. So this is the personality disorder. Personality disorders can affect different areas in a person's life. Let's see how it affects. The way of thinking about oneself and others, my own image, my own thinking about myself. See, I can think I am the best person in the world, or I can think I am the worst person in the world. That thinking about themselves, their self-image, how I look, how I talk to people, how I present, that leads on to how others perceive me. So the way I am thinking about myself and others and the way I respond emotionally. So every day, day in and day out, we respond emotionally. It's a salt and pepper of life. So we respond happily, irritable way, disgusting. Our emotions are very many. We react with the emotion depending on the situation. So in personality disorder also, the way they respond emotionally is also disordered. They can be very irritable, they can be blaming, they can be emotionally dysfunctional. So all those forms the personality disorder. And another factor in personality disorder, the way they relate to people. Because if my thinking, my emotions are different for that particular person, my relationship or the way I am relating to the person is going to be different. We will see in detail when we pick up individual personality disorders. And fourth aspect is the way one control their behavior. So all of us have a controlling mechanism in us. I might get angry with a situation, but I may not show it. One part of my mind might say it could be detrimental to you. My boss calls me and says something which I don't like, and I didn't like the way he told me. So I'm getting angry. I'm getting angry and angrier. But something in me tells me you can't react. He's your boss. Now there are consequences. If you're going to react the way you're going to react. So something holds me back. I don't do. I might carry it. I may not react immediately. So my relationship with the boss is preserved. In a personality disordered person, that is gone. So the impulse to act is taken over. They might impulsively act. It could be in any relationship. It could be any situation. They can get angry, break things. So impulsivity can creep in. They can be a very impulsive person, which can manifest in different ways. Impulsivity can be manifesting in angry outbursts or buying spree or alcohol and drug use. So that's how they become dysfunctional. So I just briefly mentioned about the different ways a personality disorder can affect a person. So we looked at what is personality disorder, and next we looked at how it affects a person and affects others also. And the next question is how common it is. It is becoming more and more common. Worldwide prevalence of all the personality disorder together could be around 78% of the population. And it is seen and more diagnosed in higher income countries. In United Kingdom, prevalence rate is 4.4%. But I'm talking about general prevalence. I'm talking about all the types of personality disorder put together. Then you will ask me, what are the types of personality disorder? I'm going to just enumerate them. We'll pick up one by one in subsequent episodes. There are 10 types of personality disorder. Antisocial personality disorder, avoidant personality disorder, borderline personality disorder, which is also called as emotionally unstable personality disorder, dependent personality disorder, and histrionic personality disorder, narcissistic personality disorder, obsessive compulsive personality disorder, paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. These are the 10 different types of personality disorder. So these are the 10 types of personality disorder. These types of personality keep changing over a period of time due to the research input what we have. So currently these are the 10 types of personality disorder. Next question is, how do you treat them? There are a number of ways we can treat personality disorder. When we talk about treatment or management in a mental health services, we are talking biopsychosocial model. Biological method is medication mainly. Medications are not that effective in treating personality disorder. They have a very limited role in personality disorder. No medicine can change the personality. It can manage the reaction. Now, suppose a person has anxiety because of the personality leading to behavior that makes him feel anxious, or patient has depression consequent to the personality dysfunction he has. Now, the problems he has developed due to the personality, he goes in for a depression, then medication can help. But medication by itself is going to cure the personality disorder. As I said, it is an enduring problem. It is a pervasive, enduring problem. So we are not looking at instant fix, instant treatment for personality disorder. Most effective therapies or treatment is psychological therapies. There are a number of therapies we use. Some of the common psychological therapies are cognitive behavior therapy, which is in short form called as CBT, and dialectical behavior therapy, in short form it's called as DBT, and mentalization based treatment, which is called as MBT. These are all some of the therapies used for different kinds of personality disorders. I'm talking about generally. When I take up individual types, then I'll talk in detail about what therapy used for what type. And there is another concept called therapeutic community, which is also very effective in treating some of the personality disorder. We will take up some of the personality disorders. I'm not going to discuss all the 10 personality disorders in detail because some of them are not very common. In this episode, we talked about personality, how it develops, what is normal development, and different concepts and theories. Then we went on to talk about personality disorder. In our next episode, we will discuss one particular type of personality disorder, that is antisocial personality disorder.